It is the year 2020. Everything's different, so we might as well make today's meeting a little different too. Dr. Whalen's here again to be our guest speaker. He does have to leave soon. So we're actually going to start with our guest speaker today. He's going to give us a COVID update, what's happening in the area, and I know he'll open it up for question and answer as well. So Dr. Whalen, I'm going to turn it over to you first if you're ready.
Thank you. I don't know how I want just like this mic in my face. Or...
You can do it, Hubbard. This is what I got, man.
It's okay.
It's for jazzercise.
Normally my voice carries, so it's not too big of a problem, but I'll happily use a microphone. So I appreciate being invited back. I was here a couple weeks ago, and this is a little bit maybe more pertinent and in my wheelhouse right now. So what I'm going to do today is just give you a quick summary of what the status of a lot of the hot button things are in the Munson system for COVID, and then open it up to questions, because I could drone on easily for a half hour and not get to the things that you guys are really concerned about. So I want to make sure we get any specific questions that you or your constituents or your connections really want to have an answer for. So what's the current status? Right now in Cadillac Hospital, we don't have any positive patients and we don't have any pending patients. So that's good. Across the Munson healthcare system, 4 patients in the hospital that are positive, 2 more that are pending. So we've been running probably between 1 and 5 inpatients in the Munson hospitals for the last week or 2. Before that, we were really around 1 or 2 or less for several weeks, and at our peak, we were probably around 12. So we did have a bit of a surge, but nothing that overwhelmed us, and it's just slow and steady right now. Testing, as you read in the paper, they're doing a great job at telling you how testing is going in the community. We probably overall have had somewhere around a 2.5% positive rate, but it's lower right now because we are testing a lot of asymptomatic people. So the paper reported 0.5%. Munson would say about 1.5% for the actual test we're sending out. We still see asymptomatic positives. So we are screening everyone who has to have general anesthesia before they have surgery. Everyone has to be tested. And we still, at least once a week, have someone who has no symptoms whatsoever but tests positive. So it is still out there. We hear a lot about community spread. There probably is slow community spread. There's not an overwhelming amount. There's not huge clusters. Early on we had a prison cluster, we had some Amish cases, but overall now it's probably just low grade in the community. So that means kind of we're all a little bit at risk. Munson and Traverse City, on the other hand, if you've been watching the county numbers, they've averaged close to 10 positives a day for the last week. So they really have a bit of a hot spot right now there. How are we doing our testing? That's always everybody's question. Do we have unlimited testing? The answer to that is just no, but we have several different varieties we can test. So Munson has an in-house test that can be run over the course of an hour. That test is available at the Traverse City Hospital, the Gaylord Hospital, and the Manistee Hospital. If we want to get an immediate test, and so where are we using that? Someone comes to the ER, we're highly suspicious, they're going to be admitted, we need to know. We courier a swab up to Traverse City, we get the result back in a couple hours. That's as fast as you can get it right now in Cadillac. But that resource, Munson can do approximately 40 tests a day across all 8 hospitals. So it's not an unlimited resource. And 2 weeks ago, they could do 60. Like the company that gives them their reagents, all their ingredients to do the test, has continually reduced what they're giving them. So that is a very severe limiting factor for us. At our current rate of use, we're going to run out of those reagents in the middle of September. We get a small delivery every week, but there's no guarantee that we're going to get that any given week. So Munson has added testing through Abbott. Abbott is called an extractable antigen test, which is like a strep test you would get in your doctor's office. That's very rapid, less than an hour. Every hospital will have a machine, at least one machine. However, that also is going to be slightly constrained. So they promised us 800 tests across the Munson system, and they gave us enough supplies to do 300. So the whole world is buying Abbott machines, and so Abbott is just trying to fairly distribute a limited resource. I because we do not have the same prevalence in our community, we're not getting all those resources. So that is a continued constraint on our ability to do testing. We can send out to Spectrum and to Mayo Clinic, which are labs. There's a plane that goes every night from Traverse City to the Mayo Clinic with laboratories, and there's a courier that drives a couple times a day to Grand Rapids to Spectrum for testing. We're using that quite a bit, probably over 100 tests total between those two, most of them going to Spectrum. We get the results back in less than 2 days. 36 hours is about average right now. That's very valuable to us. We're using that for our preoperative screening. We're using it for anybody who's urgent, symptomatic. Several of the offices in town, including ours, has access to Quest testing, which is just a national lab. They swab them at our office, they get sent to Quest. Right now, the turnaround time for that is dreadful, more than a week, which is the same as not even testing. So by the time someone is worried, we test them, we don't get the result for a week. They're either in the hospital or better. So it's not very useful. The reason for that is Quest has been directed to prioritize swabs from hot spots, then from low incidence areas like northern Michigan. And so they're just sitting on a shelf until they have time to do our swabs compared to someone, for example, from Florida or Texas. That's probably the right way to use a national resource, but not very helpful to us. There are other rapid tests and things that are available. Some offices are getting them. Most of those are not super reliable. They're better than nothing, but not super reliable. I could go into a bunch of statistics about it. I won't because it hurts my head to think about it. Basically, we have enough testing to manage symptomatic people, sick people, and we have limited access to testing for asymptomatic people. That is going to impact our strategies going forward in terms of a lot of elective things. If that becomes a more and more limited resource, elective surgeries are again going to become a problem in the Munson system. So that's definitely been a disadvantage to patients for that 3-month break. There was a lot of people whose conditions got worse while they had to wait. We don't want to fall back into that situation. It is especially important for trying to manage things like reopening schools. So the PHO, one of my other hats, and representatives from all the big primary care groups in town are meeting with the schools on Friday morning to talk about a strategy for how are we going to consistently get any kids who develop symptoms or teachers who develop symptoms evaluated in not only an appropriate scientific way, but in a fast way for our community so that we can support our schools trying to survive until we have a vaccine. So that we are participating with them, we are supporting them, and we'll figure out a way to make it as safe as we possibly can. I promise it won't be perfect. So what else is happening? Dr. Ruby asked a couple good questions. In Cadillac, if you are in the hospital and you're sick with COVID, can you get remdesivir, or can you get the antibody serum from someone who was positive treatments? Both of those are available to us. They're controlled across the whole country because they're part of a study. Like, they're not proven treatments yet. So they're a part of a national study. We are under our Mayo Clinic affiliation. We are part of that study, so we have access to both of those. Again, remdesivir is distributed based on a core need, based on hotspot availability, but right now we have enough to treat the low number of patients we have in the hospital. The same with plasma. So that is available to people. What was my other thing I was going to talk about? Oh, so vaccines. Like, where's the situation in vaccines? This starts to get a little bit from, guaranteed to my opinion, but I spend way too much of my time, in this world and talking to people who do know stuff about it, so I feel like my opinion is at least pretty well informed. I think that the broad window of the holidays, Thanksgiving and New Year's, they'll probably have a vaccine available nationally that has been proven effective. They'll have 100 million doses. They'll distribute that just like they are remdesivir and everything else to the hot spots before they send it up here. But nonetheless, as soon as we start vaccinating at that level, we'll see national cases start to decline and a slow return to normal. It'll take months, a month or two, for us to really feel like, hey, I don't need a mask, hey, I can go to Florida, things like that. But I think that's a reasonable window. By spring break 2021, I think we really should be in a much more stable, safe, predictable place. That is, subject to change. We're not going to, in the United States, we're not going to go hey, we tested on 50 people and it seems to work, so we're going to just give it to everybody place, but it's also not going to be as vetted as, other vaccines. I have a lot of patients who ask questions about it or are concerned about it. Hey, it's brand new, all of this. Basically, the one thing you can be sure in the United States is that they're not going to distribute a vaccine that's dangerous. It might not be as effective as we want it to be, but it is not going to be dangerous. And it's going to be far more dangerous for us to be under-immunized as a community than for us to be immunized as a community, especially for all our vulnerable populations. So that would be my soapbox version of vaccines. All right. Like I said, I could just keep rambling on one thing or another, but why don't we see anybody have particular questions, things that they're hearing that they're not certain about or looking for clarification on? I promise if I don't know, I'll say so. This happened my last time. Nobody has questions? I answered every single question? That's impossible. Yes, sir. Would I? Right now I wouldn't because I live up here. If I lived in Texas and I was working in a Texas hospital in an ICU, I might.
Dr. Wayland?
Yes.
I had a friend that went to another state, a hotspot, and when she came back, she had disease swab for the test, and it came back negative, but they told her to still stay in 14-day quarantine.
So two things contribute to that. One, for a while we were swabbing people as soon as they found out they were exposed. Like, oh, my friend was up on the weekend and now it's Monday and they found out yesterday they're positive. It takes at least 4 to 5 days after exposure for anybody to develop an infection. So if I swab you right after an exposure, it's useless. I would expect it to be negative. So you have to wait 4 or 5 days. So if they didn't fall into that window, so they just got back, got swabbed the first day they got back, that still left a lot of days window where they could have been exposed while they were in a hot spot and will convert later. So that's why it wasn't. The other is that there's a false negative rate in all the tests, where even if you do have it, the test will come back negative. That's depending on how far how mean they are at taking that swab and jamming it down your throat or nose, and also just limitations in the way the test works. So the safest thing is still quarantine in a high-risk exposure, even if the test is negative. Does that all make sense?
Yeah.
Okay. Yes, sir.
So I was reading about vaccines, and there's one that the military is using. Do you know which one it is? And whether this is...
I do not. But history suggests that the military would probably use something that is not as safe as others in an experimental sense. I think you sign some paperwork when you sign up that they're allowed to experiment on you with these things. But no, I don't know which one it is. I would probably take that one. Anyone else?
I got
Yes,
it.
sir. Absolutely. So wearing a mask outside is probably, unless you're really in close quarters, is probably unnecessary. So just general air circulation, the nature of the way droplets and aerosols work, you would have to be very close to someone or have them literally sneeze on you outdoors for it to be a high-risk exposure. So wearing your mask while you're driving alone in your car, even though I sometimes forget and do it, or walking across the parking lot, I had it on because I didn't want to forget it, that probably doesn't add anything to your safety. But indoors, there's no question that masks reduce the spread of droplets which can carry the virus. It's very important when you're discussing this with people that you realize that each of us wear a mask not to protect ourselves. So the mask you're wearing right now does very little to protect you from the air you're breathing. It does some, but not a ton. And a cloth mask doesn't do much at all. But it does protect everybody around you from large droplets that you may exhale, sneeze, or cough out. And so we all wear the mask to protect everybody else. So that's kind of the misconception. But it's really kind of the philosophy we need to approach this for the next few months is I'm willing to take responsibility to protect you from me. I'd appreciate you protecting me from you. Right? That would be the ideal way to message this so that people are a little more supportive. Does that make sense?
It does. For instance, in our places where we go in and we could close our doors in our own office. We're going in where regardless even in the office of the whole I think it shows that it's sticking to something wow, that right in.
So actually they've shown that fomites, meaning landing on a surface and then transferring, has been a very low method of transmission. That it's been very much person to person, through the air, through crowded groups, is by far the best way to spread it. But the shared surfaces has been very few cases in contact tracing. Yes?
Do you know with the meeting that you'll be having with the schools, if there's been anything addressed with the HVAC system for air circulation?
No, that I know of. I can certainly ask, but that often is a very big ask to change that. So my suspicion is that will not be something they're capable of doing. A hospital can barely do it in areas that are designed to be effective in it. So that the schools, without any forethought on the way they designed those air systems, I doubt they'll be able to shift that.
There's, in their plan that I read the other day, there's something that, some sort of filter they put in rooms, but not part of the system.
Jamie?
In regards to going back to school, are the family practices going to make recommendations?
So they're going to, for certain, follow the recommendations that the state has made and that the American Academy of Pediatrics has made. So that is that anyone over 5, kids over 5 should wear a mask. Under 5 should try, but is often not very effective.
Do you have statistics on, say, the age group 19 to infant, as far as how many cases here in Cadillac or in our institution?
I don't have hard numbers. They have been a higher percentage of positives. So this is mostly data based on those big, like they did at Baker College, just drive up and swab anybody. The positivity rate rose after those events because even though they tend to be more asymptomatic, proportionally they got tested a little more and there were some positives. So that made it look a little higher. But relatively speaking, just anecdotally, more new cases in younger people is very, even though we're still seeing more cases, like for example in Wexford County, we're not seeing them in the hospital. So they're not getting as sick, which implies that they're usually younger and healthier, who are most of our positive cases. But I can't give exact numbers.
Asymptomatic too.
We're really struggling to have any sense of how many people are really asymptomatic and carrying it. It's probably much more than we know. I mean, we'll know in a year, but right now we probably don't have a very good idea. I will say about antibody testing. So there's been tons of people who were sick in January, February, March, came back from spring break, etc. And we created lists when we couldn't track or get testing for those people. When testing was very severely limited, we kept track of all those people. And we've tested a great number of them for antibodies and 0 positives. So the burden in our community at the very early stages of this was all influenza and other viruses, not COVID.
What do you know about the data and guidance from the medical community that our state government's giving? Like it comes out of U of M maybe, but that's all I really heard.
It really comes out of a big consortium of all the big health care systems. So U of M likes to put their sticker on everything. And they're willing to join any group and support any group and do data analysis for any group. So they often are leading that. But they have a great consortium of the big healthcare systems who are talking about and making recommendations for the state. I think, honestly, I would say that Michigan is one of the strongest in terms of following scientific recommendations for the way they've tried to manage the disease for the state. Anyone else? Just a few more months. We just got to get a few more months and our lives can start to go back to normal. In another month, all the people from from downstate will leave. That'll make us all safer. Right? Just have to worry about our friends and if they go downstate. So, thanks guys for all your attention. And everybody, not everybody, but many people here know how to reach me. If you think of a question later, you want to just email me or call me or however you want to reach me. Yes, ma'am. So I'm of two minds on that, really. Three, probably. One, I've had heard the same things from people who have traveled. The airlines are doing a good job. There's good spacing. They're screening everybody very aggressively. They're aggressively making people wear their masks. They're separating people on the flight. So that, at least, is a best practice. If you have to travel, they're doing a good job protecting you. Would I get on a plane right now? Probably not, just because I'm more conservative in that sense than not. And the other negative is that I do watch the news every day, and a flight from somewhere to Traverse City is on the hotspot list almost every day. So somebody's on there positive. So I don't want to join that group quite yet. Anyone else? I appreciate you letting me go first and letting me run at the end of your meeting. I am basically double booked every hour for the last several months. So thanks, guys.
Dr. Whalen, we greatly appreciate you coming back again. It's going to be strange next week and not having you here. But we appreciate it. Thank you so much. Great update. All right. Well, now we'll start the meeting with the Star Spangled Banner, followed by the pledge. And the flag is up.
Dear Heavenly Father, we thank you for this day, and we thank you for the speaker that we just had that gives us hope, dear Heavenly Father, that maybe by next year we will be back to normal and not have to wear a mask. We just pray that you will guide and direct us and help us to do the right things and bless this body to our bodies to know your way and to serve you. In Jesus' name.
And music today is with Len and Tom. We have no books, right? No books. Go out and move around the world. You want to play with it? You know it? Remember it. Roaring will go round and round and round and round the world. Roaring will go round and round and round and round the world. And if the ship can roll the stars, it surely will go up to Mars. Roaring will go round and round and round and round the world. All right, same melody, but instead of rotary will go round the world, it'll be COVID will go round the world. Here we go. COVID will go round and round and round and round the world. COVID will go round and round and round and round the world. And if the ships that roll the stars, it surely will go up to Mars. COVID will go round and round and round and round the world. Funny but sad.
Great. Well, several guests with us. So, John, you want to introduce your guest?
My pleasure to introduce Reverend Mike Orlander. I'd like to stand up a minute. He's got an application, and I think we'll be getting it completed shortly, hopefully. Welcome again.
Great. Thanks, Mike. Great to see you. Tim?
My guest today is my son-in-law, J.D. Peterson.
Great. Well, welcome, Jamie. Glad you could join us today. And, oh, Dory, go ahead.
Yeah.
Yep.
My guest today is actually Connie Bryan. She works at Walmart a lot of hours. She's working at this kid to death. And he is the YAC president this year, and he's a junior Rotarian. This is Sawyer Clark.
Great. Welcome, Sawyer. Glad you could be here today. And I have a guest as well, Jeff. This is Jeff Bassett. Jeff is currently the Vice President of Treasury Management for Forefront Credit Union. Originally from Cadillac, but you haven't lived here in a while. Right?
Long time.
It's been a long time. Married with 4 daughters ranging from 7 to 23. So excited to have you here today, Jeff. And just an interesting thing I found out, so Jeff's dad I know very well. He actually taught for us at Baker for several years. So yeah, it's great to have you. Okay. So, we are still in the month of August. Any birthdays in August that have not been celebrated yet? Or anniversaries? All right, great. And I'm going to turn it over now to Susan, our Sergeant at Arms.
Not mine. 1738. 738.
All right, Jason, there's 26 cards. All right, mine's today, well, anybody that did not order a t-shirt, $1 fine. And anyone who isn't gonna participate in the White Pine Trail ride, $2. Nobody's digging, so everyone is gonna show up at the White Pine Trail ride. Okay, that's good. Wow, look at all these people. We're gonna rock this.
Kelly's honest.
I'm sure I didn't do any of those.
Don't worry, he makes lots of money.
Great, thanks, Susan. Okay, Rotary announcements. Do we have any Rotary announcements for the club today? Art?
Make sure you tune in this afternoon to Wellness Wednesday. You'll see me and Randy promoting White Pine Ride. Michelle Dunaway was out on Monday, so that was good. And this is the last week we can accept sponsorships, so please, if you know someone or if you have a sponsorship, let us know this week. We're actually doing quite well. We're over $6,500 in sponsorship so far. And right now we have 23 riders signed up for the ride. It's ticking up. A lot of people waiting for the 10-day weather forecast, so we'll see how that
announcements? If not, I do have a couple myself. Just an FYI that we're still planning the centennial celebration, and the group is going to be hopefully next week to iron out details for our October 1st event. And Susan, she was sergeant, mentioned the t-shirts. I'd love for somebody to stand up and model the new t-shirts that we got in, actually got in yesterday. Yep.
Stand up. Do your turn.
All right. Well, we ordered a total of 38 t-shirts that you all ordered. That will be great when we do our service projects and anything that you do volunteering-wise in the community, just to show that you are a Rotarian and we are people of action. So if you do want a shirt and you didn't order one, we can look at placing another order sometime in the near future. And speaking of that as well, if you did not, I have a bag up here on the front table. If you did not get your new pin for the year, this is the new Rotary pin for the theme Rotary Opens Opportunities this year. Please make sure you come up and grab one of those. And the last announcement I had was just that our next 5th Tuesday service day will be actually Wednesday, September 30th. So there will be no meeting on September 30th. We are looking at opportunities and who we can help for service day that day, looking at serving vets and seeing if there's opportunities there as well. So stay tuned for that, more to come on what that service day will look like. Mark.
Can I do a quick follow-up?
Yeah.
I would like to recognize all the people that have sponsored this ride. So Gavin, you can stand up a minute. Your organization.
Kelly.
Look at this. This is great, okay? Thank you so much. This is how we're making money with this ride. We really appreciate you guys stepping forward. So I just want to recognize that and thank you. The other thing I wanted to say is please share the ride on Facebook.
Yeah, thank you. Thanks, Mark. And thank you all for those who have sponsored. This is one of, obviously, our big fundraisers for the year, so it's really important that we get the word out. Okay, any community announcements anyone wants to share?
Randy, the Veterans is having a golf outing September 19th. It's going to be a beautiful day. I looked it up. Hopefully the weather doesn't change. It's $300 a team, $150 for a whole sponsor. We've been stuck in our houses, small meetings. It might be a great time to get out, support the veterans, and just enjoy the fellowship. And Sawyer has an announcement.
I have one quick announcement. The Youth Advisory Committee, I'm president of that this year, and we've also decided to donate 1,000 masks to the Cadillac public school system. We're giving 100 to innovation. It's the same design that you guys are doing, but we're putting our Youth Advisory logo on the side instead of the Rotary one. We're giving 100 to the innovation students. We're supplying all the 8th graders with one, and then they're open for grabs in the high school. We're spreading them through teachers and counselors.
Oh, that's great. Thanks for sharing that story. That's outstanding. Anything we can do to help our schools during this time is very much appreciated. That's great. Any other community announcements? If not, our next meeting will be right here on Wednesday, September 2nd from 12 to 1. Jen Brown, our superintendent and member of Rotary, will be giving a CAPS and education update. And I do want to thank Mike, and Jamie, and Sawyer, and Jeff for being here today. Please come again. We'd love to have you. And with that, we will close by singing Smiles.